Welcome to the KinderPage podcast from Toronto. Today is Thursday, April 17, 2025, discussing allergies in children. We're your KinderPage team, and this deep dive is really for you, all the amazing childcare providers out there keeping our kids safe and healthy. Just a quick note, this podcast is based on research, so listeners should always, verify details for themselves. Okay, so today we're jumping into the Master Allergies in Children Essential Guide for Childcare. We really want to unpack why this stuff is so crucial in your everyday work.
Absolutely. It's way more than just like knowing who's allergic to what.
Right. It's about truly getting a handle on the subtleties, creating environments that are genuinely safe, and having those really important chats with parents. Think of this as maybe your shortcut to feeling really confident about managing allergies.
Yeah. And, when we talk allergies, it's complex. It's not just a kid getting a bit itchy, right? It deeply impacts their whole day, their health, their experience.
That domino effect you mentioned.
Exactly. How one small thing can ripple outwards and how we as providers can really shape that experience, make it inclusive.
So the guide kind of starts broad, looking at the whole landscape of allergies.
Yeah, the big picture.
It's not just memorizing, the top 8 allergens. It's grasping how allergies affect overall health and how that changes, everything we do in childcare. And they mentioned the Canadian Society of Allergy and Clinical Immunology, great resource for Canadian-specific info.
Super helpful. And that big picture understanding.
Right.
That directly fuels provider awareness. It's not passive.
No.
It's about actively staying up to date, keeping pace with research, and building really solid communication with parents.
Communication is key.
Totally.
Yeah.
Because when you're truly aware, you can anticipate things, make smarter choices about snacks, activities, everything.
And make sure kids with allergies aren't just tacked on, but actually included, properly included.
That's the goal, full inclusion. And speaking of resources, kinderpage.ca is also there for Canadian providers and parents trying to connect.
Good point. Okay, let's get into the nitty-gritty reactions. The guide talks about the whole spectrum.
Right, not just the scary stuff.
Exactly. It's easy to picture anaphylaxis, but it often starts smaller, doesn't it? Like a runny nose, maybe a bit of a rash.
Those milder signs.
Recognizing those early signs is just as vital as knowing the severe ones, like difficulty breathing. It's knowing when to monitor closely versus when to, calmly hit the emergency button.
Calmly is the operative word.
Yes, professional panic only.
But seriously, that recognition needs a plan behind it. Clear, pre-planned responses.
Tailored plans.
Yes, tailored for different severities.
Yeah.
Because things do happen unexpectedly in childcare.
Oh, for sure.
And you need that roadmap ready to go, whether it's mild or, potentially serious.
Okay, food. Always a big part of the day. The guide dives deep here, starting with the famous one, peanuts.
Ah, yes, the peanut peril.
It's not really an exaggeration, is it? They stress how common peanuts are, even in trace amounts, and how serious reactions can be.
Very serious. The protein structure is particularly allergenic for some individuals.
So it really hammers home the need for providers to be like food detectives, reading every label.
Oh, meticulous.
Setting up peanut-free zones, constant back and forth with parents. They even mention a healthy breakfast ideas resource, which sounds useful for those hectic mornings.
Yeah, and the cross-contamination piece is huge with peanuts. It's why dedicated zones and careful prep aren't just suggestions. They're, essential.
Then you've got the other common ones. Milk, eggs, wheat, staples, right?
Absolutely. In so many kids' diets.
So providers need to spot them, obviously, but also have safe alternatives ready.
And know the difference between allergy and intolerance. That's crucial.
Right. The guide points that out. A true allergy involves the immune system freaking out, basically.
Launching an attack.
Whereas an intolerance, like lactose intolerance, is more about digestion. Uncomfortable, but different.
Exactly. Different mechanism, different management. Getting accurate info from parents is vital there. And clear food labeling non-negotiable.
Always. Okay, just when we think we've got the main food villains covered, soy and tree nuts, the hidden dangers.
Yeah, these are tricky. They pop up everywhere.
Sauces, baked goods, things you wouldn't necessarily expect.
Exactly. So it requires that extra level of vigilance.
Yeah.
Really scrutinizing ingredient list, channeling your inner Sherlock Holmes, as you said.
Right. Okay, shifting gears from food to, the air we breathe and the stuff around us, environmental allergies.
Indoor and outdoor triggers.
Pollen gets a shout out, naturally. The seasonal sneak attack, especially spring and summer.
Classic hay fever symptoms for many.
The advice is pretty straightforward.
Yeah.
Maybe adjust outdoor time on high pollen days, keep indoor air filtered, teach kids good hygiene like washing hands after playing outside.
Simple steps, but they help. Pollen gets everywhere. Clothes, shoes,
Ugh, yeah. They also mention nature activities for kids, finding ways to enjoy the outdoors safely.
which is important too. Okay, then indoors, we have dust mites and mold.
The delightful duo,
I
not
mean-
so delightful when they cause skin issues or breathing problems.
Definitely not. So the guide recommends regular, thorough cleaning.
Like really regular.
Yep. And using hypoallergenic materials where possible, good ventilation, keeping humidity down.
Yep.
Basically year-round spring cleaning.
Sounds about right. And finally, under environmental, pets and insects.
Less common in centers usually, but still important to consider.
Pet dander from visitors or staff, maybe? And insect stings, obviously, can trigger reactions.
So clear policies on animals and educating kids about insects. Maybe don't poke the wasp nest.
Good advice, generally. Being aware and teaching avoidance.
Exactly.
Okay, now the part we hope we never need but have to be ready for, emergency protocols.
Preparedness is everything here. Non-negotiable, as the guide says.
It clearly lists the signs of a severe reaction: trouble breathing, swelling, rapid pulse, drop in blood pressure, the scary stuff.
The signs of anaphylaxis.
And stresses having that clear action plan. Who grabs the epinephrine, how to use it, who calls 911, who notifies parents immediately.
And practice. Regular drills for all staff are so important. Muscle memory in a crisis.
Yeah, they point to Health Canada's info on severe reactions, too, another good resource.
Knowing exactly where the autoinjector is, how to use it without fumbling. That confidence comes from training and practice.
And while waiting for help, first aid still matters.
Absolutely. Basic first aid can stabilize things. Positioning the child correctly, monitoring vitals.
Being ready for CPR if needed. And having that well-stocked, allergy-focused first aid kit accessible. Plus, up-to-date training for everyone.
Critical components. It buys precious time.
So wrapping it all together, the guide really emphasizes prevention and communication as the cornerstones.
That's where you make the biggest impact proactively. Minimizing exposure, keeping those communication lines wide open.
First step, that updated allergy list. Sounds basic, but it needs detail, right?
More than just the name and the food. Specific allergen, reaction severity, medications needed, emergency contacts.
And reviewed regularly with parents. It's a living document.
Exactly. It has to be accurate now. It's the central reference for everyone.
And then training and awareness again. Ongoing, regular training.
Covering everything: food, environment, prevention, emergency response. Fostering that culture of continuous learning. Things change.
Best practices evolve.
Staying current is part of professional responsibility in childcare.
And it all feeds into the ultimate goal: building that safe, inclusive environment where every child feels secure and can thrive, allergies or not.
Which means careful planning around meals, snacks, activities, but also working with parents and kids, understanding their individual needs.
Collaboration.
Yes. Building trust and ensuring that care plan is truly tailored and makes the child feel supported, not singled out negatively.
Well, understanding and managing allergies is just such a massive responsibility in childcare, but being informed, proactive, communicating, it makes all the difference.
It creates that safer, more welcoming space for every single child.
Absolutely. And remember those resources: Canadian Society of Allergy and Clinical Immunology, Health Canada, and KinderPage.ca for info and connections. Especially for providers listing their centers on KinderPage.ca, highlighting those allergy-aware practices can really connect you with the right families.
Good point.
So we hope this deep dive gave everyone some valuable takeaways. What other questions are out there about creating safe environments? What are some of the maybe trickiest allergy challenges you face day to day?
Yeah, keep the conversation going.
Definitely. Keep exploring, keep learning. It's vital work.